All right, folks, we're going to get started. Thanks for joining us in person. We've got quite a few folks online as well with the Zoom option. Just want to say hello and welcome to FURst Aid, Recognizing and Treating Equine Gastric Ulcer Syndrome, presented by the Oregon State University Carlson College of Veterinary Medicine. It's great to have you all today. We've got folks from across the country on Zoom. My name is Jens Odegaard. I'm the Director of Marketing and Communications here at the college. And at the college, our mission is to advance the health of animals, people, and the environment through inclusive and equitable education, research, and services to the public. We currently have 365 students enrolled. 332 are studying for their doctorates in veterinary medicine. 33 are graduate students in our comparative health sciences program, and 9 students are dual enrolled in our DVM and comparative health sciences degrees. The college serves the public with research and direct clinical and diagnostic services through the Lois Bates Atchison Veterinary Teaching Hospital and the Oregon Veterinary Diagnostic Laboratory. A few housekeeping notes for today's presentation. For those of you online, at the bottom of your screen, you'll see a Q&A feature. You can put your questions in there throughout the presentation. And at the end, during our Q&A time, we'll get to as many of those as we can. Folks in person, if you could hold your questions till the end, and we'll get to those as well at that point. Quick note about questions. We will not be able to answer questions specific to your animal or case. Those should be handled with your personal veterinarian, but we can answer general questions about gastric equine ulcer syndrome. I'd now like to turn it over to today's presenter. Dr. Mariya Pitel is a board-certified large animal internal medicine specialist. She's also certified in veterinary acupuncture, and she's an instructor of rural veterinary practice here at the college.
Thank you so much for that introduction. I'm very happy to be here and chat to everybody. It's one of my favorite topics to talk about, partly because it's one of my favorite diagnostic tests to do. So it's something I really enjoy doing. And I think there's a lot of information to kind of be gained from it. I think there's also a lot of online information that you can find about it, where you type in gastric ulcers and a myriad of search options come up, and different discussion boards and things like that. So really happy to chat to everybody about it. We can go ahead and get into it. All right. So a little bit of the outline, kind of where we're going to talk about today. Start with some clinical signs, and then we'll kind of break it up into the two main types of syndromes that we talk about when we talk about gastric ulcers in horses. We used to kind of the old way, you'd say gastric ulcers and it kind of meant one thing. And over time, as our diagnostic abilities improved, and as we did more studies, we realized that there's actually two different syndromes that gastric ulcers generally encompass in horses. And both of these have slightly different presentations, and they have slightly different treatments, they have slightly different causes, so it's kind of worth distinguishing between the two of them. And it's going to be the equine squamous gastric disease, which if you look at this image, this is the horse stomach kind of out. And just as a note about the presentation, there will be lots of images of intestines of horses. So just FYI, it's a little bit graphic, but not horribly graphic, at least in my opinion. But if you're somebody who's particularly squeamish, take note. So looking at this horse stomach here, you can see there's this slightly paler portion of the stomach, and this is the squamous portion. And it's truly quite different from this slightly pinker, darker portion down here, which is the glandular portion. So the squamous portion of the stomach has the lining of it very similar to the esophagus. So if somebody's ever had esophageal ulcers, you get heartburn, something like that, that type of lining, that's that top portion of the horse's stomach. And then this bottom portion, that's where that acid is actually produced, and that's the glandular portion. And so this line of demarcation between the two of them, this is called the margo plicatus, and that's kind of our classic site of ulcers, where we get, then it's termed kind of splash of the acid up in from this glandular up into this squamous portion. It's not exactly splashing. The stomach isn't, a balloon that's filled with air in the body normally. It's kind of a compressed balloon, but if there's not adequate feed in the stomach, that normal acidic contents of the glandular portion can come into contact with the squamous portion. Squamous portion isn't quite prepared for that type of contact, so that's why we often get ulcers. And so this margo plicatus is our main target site where we want to take a look at for those squamous ulcers. The glandular ulcers, by their name, typically happen in this kind of lower ventral glandular portion of the stomach. One of the really common sites is up here, right, by the exit point of the stomach, which is the pyloric region or pylorus. The pylorus, that's where we exit. Right here, that's where the esophagus comes in. So you kind of come in here, food kind of drops in here, gets digested, and then gets squished out that way. So that's kind of our roadmap to the stomach today. I'll make a little note about hindgut ulcers just because that stuff oftentimes comes up, and a lot of times when I say, oh, those ulcers in the pyloric lower region of the stomach, I have oftentimes hear people asking like, oh, is that hindgut ulcers? It's not, and so we'll talk about that briefly. And then we'll chat a little bit about diagnostics, treatment, and then ideally prevention of ulcers in horses. So clinical signs, and this is a little bit of a nebulous thing, because as much as we would like to hang our hat on a single thing that like your horse does, and you're like, ulcers. It's not quite so simple, unfortunately. Probably the most consistent colic signs when I'll say that, all right, I'm truly worried about ulcers in this horse is that they have kind of chronic, mild, moderate colic signs. So they get colicky, they get their dose of Banamine, or they get walked, or they get sometimes they get better, but it happens relatively frequently. I'm gonna be a little bit more worried about ulcers in those guys. It's not to say that that is the only cause of those colic signs in those horses. And colic is in itself, it's not a diagnosis, it's a clinical sign. It just means abdominal pain, and anything inside that abdomen might become painful, might cause colic signs. So although I have a higher index of suspicion in those horses that they may have ulcers, it's not a one and done. I can hang my hat on that and say this horse for sure has ulcers, I'll treat it for ulcers, the colic will go away. But that's where I worry about it. Poor weight gain is another thing that sometimes comes up, and certainly horses that are skinnier, you know, they don't gain weight very easily. There may be a little bit more flighty personality, right? They're a bit more spooky sometimes. I'm gonna have a higher index of suspicion for ulcers, but I've seen plenty of nice, round, chunky horses still have ulcers. Seen calm and quiet, still have ulcers. So it's not, you know, as clean cut as we want it to be. Rarely diarrhea is seen in some cases of hindgut ulcers. So these are more of the colonic type ulcers, which we cannot evaluate with a camera. Those cases I will see some diarrhea in some instances, and I think there is probably a proportion of horses that have both. So they have, you know, maybe a disruption to their normal mucosa of their intestines in general, and then they have ulcers in their stomach and they have ulcers in their colon. So you do see diarrhea. But diarrhea alone, generally, that's not one where I will for sure go for ulcers being my first thing. And that's also something that's been not shown to be consistent in studies. Dull hair coat, that used to be kind of an old clinical sign that we talk about. The latest studies haven't, again, consistently shown any connection between the two. Not to say that occasionally a horse's coat might change after treatment. So then on an individual level, there may be an impact, but generally not something that we see on a broad population of horses that we're like, oh, went from like a dark bay to more of a copper bay ulcers. Maybe not. For performance, I think that's probably one that's a little bit more consistent, but it's hard to grade, you know, like what do we call appropriate for performance for our horses? That's such a subjective finding. In race horses, they can measure stride length, and they have, you know, lots of information on genealogy, and the grandfather had this stride length and the mom had this one, so they might have more kind of data to say like we expect the offspring to do this, but that's hard, right? They're individuals. That being said, and this is where I kind of rely on my owners to give me a lot of information, because you see your animals all the time. I see your animals ideally just, you know, once, maybe twice a year, sometimes more frequently, but you still have the breadth of information to give me about how they're doing at home, what your kind of interpretation is, things like that. And so poor performance is something that I'll commonly see being a presenting complaint, and then we talk about scoping them. And that's also something that I see where that it does improve, in fact, after we do treatment. If we find ulcers and we do treatment, that does tend to improve. And I think there's a lot of kind of physiologic things to think about. You know, if your stomach hurts and you're a jumper and you're asking to kind of do a full extension as you're going over that jump, or race horses, right? You want that full extension, and now you're kind of pressing your stomach in places that might be uncomfortable. So you might be only going halfway, and you might be kind of flattening over the jumps and not kind of coming into a nice round frame. Same with dressage horses. Are you not rounding up? Barrel races, are you not rounding around the barrels? Are you kind of running flat? So those are some of the things we see lots of other stuff can cause it. And this is kind of, I guess, my unfortunate point of this slide. It's a lot of nebulous clinical signs. None of them are 100%. If they have a side pain or back soreness or something else, that can also cause those, you know, flattening out and poor performance. And then kind of that drawn in, not very interactive, right? If the horse just, it's the classic ADR, don't seem right. And I found that this image kind of, I don't know, demonstrated it really well for me, right? Sometimes you look at a horse and you're like, you have ulcers? And that's a worthwhile question. And the issue is that we cannot differentiate what type of ulcers they have on clinical signs, and neither can we always say that how the severity of those ulcers, or even if they have them on clinical signs alone. So ultimately we end up having to do a lot of scoping and looking in the stomach. So kind of distinguishing between that squamous gastric disease, we'll kind of chat about that first. This is the classic gastric ulcer disease. Think about your racehorses. Those are truly, quite literally, the poster children for this. Up to 100% of racehorses in active race training have ulcers. So they're high stress. They're, you know, usually box stall rest. They generally don't have green big pasture turnout with all their buddies when they're in race training. They're fed big grain diets all the time because they want that muscle and want that energy. They get ulcers. And this is kind of the associations with it. High stress, work, and again, that's sometimes a bit of a question. What is high stress for a horse? And I think, again, there's individual variability. For some horses really enjoy shows. They don't get stressed out about it. They see lots of other horses. They get interaction with frequently. They're maybe more stressed at home when they're an only child, so to speak. They hang out by the barn by themselves. They get seen twice a day. Maybe that's more stressful for that animal. Generally speaking, though, at home is calmer, quieter, right? Less changes, and travel, more changes, different water, different hay, different people interacting with them, different amount of space that they have. So that's kind of our classic interpretation of that. High carbohydrates diets, and this, I think it's important to make a distinction between, I find that we often call any sort of pelleted feed a quote unquote grain diet. And in these cases, what I'm saying as far as grain diets, calling true grains like oats and corn. So if you have a pelleted feed that's predominantly hay-based, that's going to have actually a pretty high fiber content, not as easily digestible carbohydrates. So think about anything with senior in it. Generally, that is a hay-based diet. So it's either alfalfa or something beet pulp-based, has some sugar but isn't straight sugar, versus oats, like straight up oats. That's a lot of easily digestible carbohydrates. And then frequent shows and competition again. And this is also where it's important to think about the intensity of the exercise and the intensity of the stress that the horse is under. Some horses do, most of them actually do really well with low, maybe mild, moderate, but consistent exercise. So it's not to say that all exercise is bad. Different intensity exercise. Are you kind of working at that horse's comfort level, or are you constantly always asking for a little bit more, and maybe that's a little bit more stressful? And then again, shows competitions, new horses, etc. So looking at these images here, this one on the right, that is a horse with some moderate ulceration. You can see there's even some bleeding here. This image on the left, this is a normal looking stomach. This is that squamous portion. It's similar lining to your esophagus. It's wider. And this is the glandular portion. This is where the acid is produced. And this definition between the two, that's the margo plicatus. You can see it's a pretty nice, easy transition. It's not thickened at all. So this is pretty, I'm pretty, looking at the stomach and the horse normally, I'm very happy. I'm like, yep, that's what it all should look like. And you can really contrast with how aggravated and just angry this guy is on here. You all see these portions right here, kind of fingers going up into that clear part, so that those are the ulcerations. These aren't very deep, so I would say these aren't deep ulcers, but they are pretty extensive. The majority of that stomach is affected. And compared to this case right here, where these are pretty pinpoint, smaller little ulcers, I think this is a lesser curvature of the stomach. But you can see again, squamous portion should be nice, white like this all the way through. This is that margo plicatus right here, that definition between your squamous and glandular portions of the stomach, and all of these are little pinpoint ulcerations. And that's a bit of a question, you know, this horse right here, I would expect that horse to be quite clinical. I would expect that horse to be a little colicky. This might be an incidental finding. So not all, and I find some horses are just particularly stoic. I'll find lesions on them. I'm like, my gosh, why aren't you colicking every single day? This looks horrendous. And I'll see a lesion like this on a horse. I'm like, I guess this could be a problem, but man, that seems quite small. And I'm always like, well, let's treat it and see if the behavior goes away. And lo and behold, we treat and the behavior goes away. And I'm like, really? That was what was making you kick out under saddle? But they are individuals. So I think that kind of keeps things interesting on my end. And there are certainly some cases where we see this, we say again, I'm not sure if this is the cause of it or not. Let's treat it. If it goes away, great. The behavior, if it doesn't go away, we need to look for something else because there's something else going on. So we oftentimes talk about our equine squamous glandular disease in terms of grades. So if you get a scope, your veterinarian will likely give the horse a grade or on a scale on how severe that ulceration is. And the grade 0 would be normal, and down to a grade 4, which would be quite extensive and severe lesions. And there's some level of kind of subjectiveness to this. For example, in this grade scale, this grade 2, depending how the rest of that stomach looks like, I might call that a grade 3 even, because that's a pretty deep ulcer. You can see there's a big old cavity here. But if the rest of the stomach looked pristine, I might say, all right, this one maybe has one focal severe ulceration, otherwise it's pretty good. Versus this one, again, I think that's the whole stomach is kind of this red, angry, and this is that squamous portion that should be this color. So it should be this pristine white. You can see how it's all irritated. And this just looks like a disaster, right? So that grade 4 horse, that's probably an active colicky horse. So now we kind of talk about the glandular gastric disease, and this one we know a little bit less about, which is fun for everyone. And it's a little, we know a little bit less as far as the predisposing factors for it. There's been lots of studies that have been inconsistent with their findings. Some studies have found that the more different types of people that interact with the horse, they were more likely to develop glandular ulcers. So you're like, okay, like what kind of, like good people, bad people, what kind of people? And these ones are also less commonly associated with high-grade diets. So diet, although it's, I think fiber content of the diet has an very important kind of cause-effect to the disease process for glandular ulcers. The high-grade diet, carbohydrate, easily releasable, seems to be less of an effect on that. And some of the kind of behavior stuff, they've looked at horses in pasture settings versus stalled horses, and that because in the story for squamous disease, generally pastured horses have less likely to be to have ulcers of squamous origin. With glandular disease, there doesn't seem to be an impact of that. So there seems to be something else we have yet to kind of definitively identify. I do feel like there are some cases that start out as a primary glandular disease that then, because of the dysfunction of the stomach, causes secondary squamous disease. So sometimes we see these polyps. So I'm looking at these images. So this black hole right here, that's kind of the exit point of the stomach. So on the other side of that dark cavern, that's going to be the small intestines. And in some horses, if they're small enough, we can actually drive into the small intestines with our scope. Not very far, but enough to like say that we were there. Graffiti it and leave. But you can see this mass right here, right at that entrance, and this is that same portion as it's contracting. So that area is constantly contracting. If you're sitting there watching it, and we'll have a video here shortly, you'll see it's constantly moving. And you can see it almost acts like a ball that's occluding that orifice. And so what can happen with horses is that they may develop delayed gastric emptying. So as their stomach is trying to contract and push that food bolus down the line into the small intestine, that ball plugs it up and they can't actually move. So some of these guys will actually, it takes a lot longer to get their stomach empty enough to scope and to see that. And that oftentimes is part of their disease process. And the other thing that I've kind of noticed that these ulcers seem to be potentially more common in warm blood horses, and we don't know, is that a genetic link? Is there something about their genetics that's causing that increase? Is it something about their use? Their stalls were used for different purposes. Is there something with that husbandry that's leading to that increased risk? These are still questions that we're trying to answer. And these ones also generally take longer to treat. They're a little bit more of an adventure to treat. usually sign my clients up for like, all right, we're gonna get through this together, but it's not gonna be an easy one. Squamous ones, usually those respond generally to omeprazole pretty readily, but among omeprazole, they do great, you recheck them, they do fine, you don't worry about it. The glandular ulcers, especially if they're kind of these polyps or masses, those can be a bit more tricky. And this is what that normal caloric region should look like. So it should look honestly quite boring, right? And this case, so this was an interesting one. And this is in sequence, these scopes. These first two are about 2 months apart. This third one is actually these first two are 1 month apart. This next two are 2 months apart. But you can see we first noted it here. This is that pylorus exit point. This is that mass, and it looks fibrinous. It doesn't look super angry, but a little angry. It actually got worse. And the horse also had some squamous lesions in the main body of the stomach that we were treating at the same time. Those went away, those looked fabulous. This lesion actually got worse, so that recheck, we changed up the medications plan and rechecked 2 months later. Now you're starting to see some healing, and you can see this kind of spider web almost pattern as normal mucosa starting to heal over the top of that, but these take a while. These truly do. And this is kind of what can happen in some of these cases if they have an obstruction or that pyloric region isn't working well. So this is the pylorus. And this right here, that's reflux of small intestinal contents back into the stomach. So our small intestine's up on this other side. And not consistently, I think there's still a lot of debate on what kind of chicken or the egg. Is there dysfunction that you have this reflux and that's causing your squamous ulcers, or do you have squamous ulcers, inflammation of your stomach, therefore you have dysfunction of your stomach and you get reflux back? I don't think we have that specific answer at this point, but in my head, my story is that can't be good. That's backflow. That's not supposed to be flowing that way. If this was a toilet, I'd be upset. So that's the way I look at it. This video is, sorry, it's a little grainy, but I think you can appreciate, so this is that caloric region and it's contracting there in the background. You can see all this like really deep ulceration. Got a couple of those masses there. This guy on this other side, you can see here that's a really deep ulcer. I was actually worried that one was going to be like all the way through. And that horse impressively did really well on treatment. We put her on medications. Clinically did well. We did not get a chance to rescope him, but this was a chronic colic, like had multiple very severe colics. Ultimately diagnosed him with glandular ulcers and treated him and did well. So because glandular ulcers can kind of vary in their appearance, we don't have a perfect scale like we have for squamous ulcers as far as grading them. So we generally describe them. We say how many there are, kind of what they look like, were they bloody, were they cavitating, were they mass-like. So if you have a scope that's performed a lot of time in your horse does have glandular ulcers, you'll usually get, a scale for the squamous portion, and then you'll get a description for the glandular ulcers. And this, I think, again, just shows that there's still a lot of information for us to learn about it. So a little bit note about hindgut or colonic ulcers. So that's most common, like the clinical term for that would be right dorsal colitis, not related to the stomach specifically. Whether or not the same disease process can affect both is a little bit up for debate, but the right dorsal colon is a very different structure from the stomach. So hindgut ulcers, completely different stomach, just completely different organ from gastric ulcers. It cannot be evaluated with endoscopy. So that's kind of in the middle of the GI tract of the horse, which is many feet long. And we can't, either end that we try to get to it, we won't get to it because our scopes are usually 3.2 meters, which is 9 feet, I want to say, something like that, 6 feet. So the scopes are long, but they're not nearly long enough to reach that area. This area can be evaluated with ultrasound. So a lot of times if we're worried about hindgut or colonic ulcers, we'll recommend an ultrasound. We can see thinning or thickening of the intestinal wall in those cases. In this case, this was a colon out of a horse that did not make it, unfortunately. But you can see these kind of reddened areas right here. And this is the outside of that colon. So you can only imagine what the inside of that colon looked like. And this was a lot of petechiation redness. Shouldn't have this kind of appearance. Should be, this is a bit more normal section of it, but it's almost bruising. Clinical signs for hindgut or colonic ulcers generally are more severe than most cases of gastric ulcers. Usually these horses have diarrhea, they're kind of more systemically ill, they're sicker. Instead of just feeling a little bit off, they're usually properly sick, usually have depression, marked weight loss. But again, it's because it's an area that's maybe a little bit harder to access and image. And not, you know, a field ultrasound may or may not be able to penetrate deep enough into a horse's abdomen, that we may be underdiagnosing some of these. So just as a comment, I just wanted to address it because I think it comes up frequently. So talking about the prevalence of these types of ulcers, so for squamous gastric disease, again, so I have the image of the racehorses on there because the racehorses are truly our poster children for it. 37% of untrained horses are affected, but that increases to 80 to 100% within a couple of months of race training. Standard bred horses, similar, 38% if they're outside of training and up to 87% in training. And they've actually found in a couple of these studies that for race horses, the ones with mild ulcers, so not the severe ones don't race well, right? They're losing money, they're not doing so well. But the horses with mild ulcers, like a grade 1, generally actually had better race times than horses with no ulcers. So there appears to be some level of stress or some level of something that's beneficial to their performance. So I think in that way, we're almost selecting for it, right? We're selecting horses that are desperate to win and they want to do these things. And that may come with its own side of problems. English sport horses, you know, it's pretty varied, 15 to like maybe half-ish. I guess the way I look at these numbers, I'm like, yeah, half to maybe a little less than half. Western pleasure was a recent study. Interestingly, that study was Western pleasure horses in Germany. Most of the paper was in German. I couldn't quite figure all of it out. But there's a pretty big Western pleasure population out there, and they had about 80% of the horses, which is a little interesting to me because I don't know, you know, is the type of management and care in that specific region, would it be different from our Western pleasure horses here? So because I think there, as you can see, there is some impact on the type of lifestyle that horse lives and their incidence of ulcers. Endurance horses also pretty high, about half of them out of competition, and decreases again close to that 100% while competing. Backyard horses, they generally have the lowest, right, lowest stress. They generally just on pasture, nobody's worried about them putting on a lot of muscle. They're not getting a ton of oats, 11%. Interestingly, that's 61% from feral horses. That was from an abattoir study in the UK where they found that. So I don't know what social pressures feral horses in the UK suffer, but they have pretty high ulcer rates. Glandular disease, again, this one's a little bit less well understood, not as high prevalence in most of our horses, but it's a little bit inverse as far as the English sport horses seem to have a higher prevalence almost for the glandular ulcers compared to those more easily treated squamous ulcers. But everybody else still has, you know, it's relatively frequent. Like this stuff is out there and it's out there with some frequency. So diagnostics, how do we figure it out? Ultimately, we gotta take a look. Gotta take a look inside the stomach to see where the ulcers are, how severe they are, so that we best can come up with a treatment plan that works for the horse, because each one is an individual. You can use a lot of indices to kind of suspect that that's what's happening, and I think a lot of owners, I think, worry about performing the diagnostic test. They do have to be fasted for a pretty long period of time to get that stomach really empty so we can actually take a look. And you'd be surprised how little food it takes to make the stomach look full, because the horse's stomach is actually pretty small, relatively. You know, especially if you compare to something like a cow, right, where it's the majority of the cow is the rumen. The horse's stomach is relatively small. And so even if we have in one treat, because I've had a couple of horses that maybe are a little needle shy, so I give them a bit of a treat to get the sedation in right before we scope. And then I scope and I'm like, I should not have done that, because now I can't see half of my stomach because there's cookie everywhere and we end up having to lavage it out. But because of that, they require about 8 to 12 hours of fasting. Those horses that have delayed gastric emptying may require more. So some of those who might scope them at that 12 hours, and we're like, it's still full of food, we still can't see anything, we might even have to lavage the stomach clean. I've done that a couple of times. So that's something to kind of consider. And the other risk that we talk about mild colic signs, we do fill up the stomach with air in order to be able to drive around with our camera and take a look at everything. We do suction that air out once we're done. However, in the meantime, if a gas bubble made their way through, they might get a little bit of a mild gas colic. Generally, that responds to a little bit of anemia and a little bit of walking. They tend to do well. So it's not a big concern of mine, but that's something I usually talk about. And then nosebleeds. We're going up the nose. They have to tell they're awake. They're sedated, but they're awake. They have to let us go up their nose. It's a long thing that goes up their nose, and it goes in and out and in and out for about 20-30 minutes. Some nosebleeds can happen, generally self-limiting. It can look like a lot because a little bit of blood goes a long way. Horses are also quite large, so they have a lot of blood to give. And we also sedate them, so they're hanging their head down as they have a nosebleed. And we generally can't quite help them hold it all the way up. Self-limiting, nothing I worry about too much, but that can be a bit impressive when a bad nosebleed happens. And then the other question that I think is always worth discussing is worsening ulcers, right? Because then my next recommendation as far as treatment for ulcers or prevention is going to be, don't let your horse ever have an empty stomach, except for this one procedure where it needs to be empty, really empty, and we're going to starve it for 12 hours. What are the risks of us causing ulceration in those cases, or making ulcers worse in horses that already have them? And I think that's worth discussing. I think it's rare that I see that happen, but I won't say that it doesn't happen. And there are some horses that we've scoped them, we've done the recheck, and we're like, man, that was really hard for this specific horse. Like they really went backwards a little bit. The nice thing is that we have 2 time points. We know what their clinical signs are, and we know what their stomach looks like in those instances. So I do find that information quite useful, but maybe that's a case where we say like, all right, unless we really have to, we're not going to do this diagnostic again. The other question always comes out with, well, I suspect ulcers, can't I just treat and see if they get better? And if they get better, great. You can, you absolutely can. The difficulty with that is, one, the treatment isn't cheap. Like the GastroGuard, full month of GastroGuard, you're spending like a couple of thousand, maybe 1,700 if you find a good deal. It's not cheap. And if your horse gets better, great. But I can't give you very specific recommendations of how long to keep them on treatment because I don't know how severe or where those ulcers are. And then the other thing too, if they don't get better, is it because we are not on the appropriate medication type? Or we don't, we're not treating the right type of ulcers, and that's why they're not getting better, or is it because they don't have ulcers? So I always say, hey, if you want to give it a shot, go for it. And then I guess if they get better, I'm always like, great, I would like to know how severe they are. So you can always do it. My feeling is that I generally still want to see the scope, regardless of what those results are. But I've certainly had owners suspect ulcers, we treat, they go away, the horse does great. I mean, I can't be mad at that. I'm pretty happy with that. Don't have many specific answers, but I'm not mad. All right, so what are we doing in the stomach once we're in there? So we, like I said, we go up the nose. They have to swallow us down, so they have to be kind of awake enough in order to swallow us. This is where, as a veterinarian, I get really nervous because if we take a wrong turn, we end up in the mouth, and there's teeth in the mouth, and then the mouth and the teeth bite our scope, and then we can't do scopes anymore. But once we're in the esophagus, we kind of shoot our way all the way down, and then we do kind of this round trip in the stomach, kind of do a slight bit of a U-turn so that we're facing back at the caloric region. So this is kind of this big turn right here, that's the greater curvature. This little turn right here, that's the lesser curvature. So at some point, usually in the stomach, we're looking back at ourselves. And actually, you can see that here. This is that lesser curvature. This is us coming in from the esophagus. This is the glandular kind of exit caloric region down here. And this is me just shooting some water at the stomach wall to kind of clean it up and see what the ulcers look like. And this is, these are ulcers at that lesser curvature. So that's kind of our plan of attack when we get in there. This is why we kind of have to distend the stomach with some air, because we need to be able to kind of push against it in order to allow our scope to make that U-turn. And if there's a bunch of feed down here, we're going to get trapped in it, and then we won't be able to move. We get stuck. And this is why it's important to have the stomach be empty. So let's say we went in there, we looked at it, we found ulcers. What do we do about it? GastroGuard is pretty common. Omeprazole is the drug name. It's the only FDA-approved medication to treat squamous gastric ulcers in horses. It's a proton pump inhibitor, so it's the same thing as Prilosec, and it reduces acid secretion. UlcerGuard is the same medication with a different label. So if you look at the medication labels, kind of make it out. You can't really make it out on this one, but it's the same volume of drug and the same type syringe. The labels are different. UlcerGuard is labeled for the prevention of gastric ulcers, and GastriGuard is labeled for the treatment of gastric ulcers. And so their labels are different. UlcerGuard says give quarter tube once a day. GastriGuard usually you're giving about a full tube once a day. You could do either one. Like as far as treatment, you just different volume of drug that you're giving. The one place where that does play a role is if you have a horse that is insured, your insurance is going to want you to use the labeled medication. So you can't use UlcerGuard to treat gastric ulcers in some insured cases, something I've come across before. So I usually recommend don't do that. Generally, the GastriGuard is also cheaper. Even though like the per dose, the UlcerGuard is cheaper since it's 4 doses for 1 tube, it gets funky. So just as an FYI, UlcerGuard is available over the counter. GastriGuard you have to get you have to have a prescription. The key thing about this medication is that also needs to be administered on an empty stomach, which once again, you're going to say, but wait, you are also in the same discharges are going to tell me not to make sure my horse's stomach is never empty, except for when you give this really important medication that's very expensive. So yes, ideally to prevent ulcers, never empty. However, when treating ulcers, stomach needs to be a bit empty for this medication to work. And because of that, it's important to talk to your veterinarian about your kind of daily regimen for your horse, because if I know, I understand what your constraints are as far as timing and when your horse gets fed, who feeds your horse, all those things, I can give you better recommendations on when to give these medications so that they're most effective, so that all that money you're spending on it is actually leading to resolution of your clinical signs. So most commonly I recommend first thing in the morning, 30 to 40 minutes before feed. And this part is also important. You have to wait kind of for that drug to start working before you then add in a bunch of hay on top of it. Carlson is another medication we'll oftentimes use, especially if we're worried about glandular ulcers. It acts as a bit of a binding agent, so it creates a band-aid over the ulcer bed and kind of stimulates healing, stimulates blood flow to it, helps it heal a little bit faster. So some horses with more severe squamous ulcers, I may prescribe Carlson as well, especially if they're showing active colic signs. The GastriGuard omeprazole that takes about 3 days to fully kick in, so it's not an immediate one, right? This is why we used to have back when we had Zantac or ranitidine, which is the other drug type. Their general slogan was like, it works immediately, you don't have to wait, because the parasite might be good, but you have to wait for it to work. So we're kind of in a similar realm here as well. Esomeprazole is another kind of derivative of omeprazole that's out there, being used more on the human side, starting to get used more on the horse side. There's very limited research on it on the horse side, so anecdotally seems to be working. Might be an option for some cases, but there's not that much research on it quite yet. I'm sure there will be more coming out. And this is just a little bit of a note about compounded medication. So compounding is sometimes a good way for us to get meds into horses that are picky about meds and they want it, they don't want the pills, so you can get it compounded that's flavored with apples or oranges or whatever your horse wants to eat. So compounding has a place in vet med. Some medications are easier to compound than others. And omeprazole, GastriGuard, that's one where we have found that the compounded formulations are usually not as effective or not as consistently effective as kind of the real deal. Compounded medications are also generally cheaper, so it's another often reason that we reach for those. So in this study, they looked at acid suppression in horses. The stop line, that's the name brand stuff, and these other 3 products are compounded medications. You can see one of them, this had a pretty decent suppression of acid. These other 2 were not very effective, but it was a bit inconsistent. So it's generally the finding is that it's not to say that compounded medications won't work for sure. We just can't, they're not as consistent in the results they give us. So if they don't work, I don't know if it's because the medication just didn't quite work. In other studies, they found that the reported amount of drug in compounded medications varied greatly. Sometimes it was more than what was supposed to be in there. Sometimes it was less. A lot of times it was what was supposed to be in there. But then the other question is shelf life. So some of those medications had really high levels at the beginning of the month. At the end of the month, they were below what they were supposed to be, so they weren't as effective. versus the non-compounded, the Gastrogard name brand stuff, that tended to be consistent. Not really a plug specifically for Gastrogard. I do use a lot of it, prescribe a lot of it, but that's, and not to say again that the compounded medications won't work. Those are just some of the hurdles we run into. I have had horses on compounded omeprazole that did well. It can happen. I just can't always rely on it. Other medications we'll oftentimes use. So speaking of those other antacid medications, cimetidine, the other ones are being also famotidine or ranitidine. Ranitidine is actually preferred. Once they got pulled off of the human market, we don't have access to it quite as much on the horse side. So we've switched and started using a little bit more cimetidine. These are H2 antagonists, so just a different type of acid suppressing medication. It does have variable oral absorption in horses. This is why the ranitidine needs to be preferred. It's also generally considered less effective. Can be easier to administer. You don't have to wait kind of that 30-40 minutes before feeding your horse, but it generally has to be they generally have to get it more frequently, where the omeprazole is the once a day. The cimetidine, in some clinical cases, up to 3 times a day. A lot of times for home use, I prescribe it twice a day. Misoprostol is the prostaglandin E1 analog, so it reduces acid secretion, but it also specifically helps to heal glandular ulcers. And this is one where if I have a particularly resistant glandular ulcer case, I'll reach for that. This is also the drug that we use in right dorsal colitis. There are slightly more frequent side effects with this medication. I can see mild colic signs, occasionally diarrhea in horses that are on it. You generally tell owners, let me know when that happens, and we'll titrate the dosage down a little bit until they're a bit more comfortable with it. It works well for the glandular ulcers. Generally, it will not heal the squamous ulcer, so I can't rely on it as well to heal the squamous ulcers. All right, so prevention. And this part, I think, is really important, and kind of a lot of these things kind of go hand in hand. You can do all the medicating that you want, but unless you kind of address some of the inciting causes for ulcers in your horse, you're probably not going to be as effective, or you'll probably have to continue treatment, repeat treatment, etc. So ideally, keeping horses' stomachs full, except for when you get those medications. So that's important. But keeping their stomachs full, feeding them frequently, slow feeders, more frequent feedings, pasture access if your horse can handle it, right? If your horse has laminitis and metabolic syndrome, that may not be an option. But this really helps to buffer the acid. And the key thing you really want to kind of encourage horses to do is to chew. Because when they chew, they salivate, and saliva is just a wonderful buffer. It's probably the best one on the market. If I could bottle it, I would. But reducing the amount of grain or concentrates, again, those true sugars, those true grains like corn and oats, reducing the use of those. And some horses, if they're a hard keeper and we want them to gain weight, we're worried about ulcers, we're worried about high grain diets, we'll put them on fat supplements, a little bit of rice bran or canola oil, something like that. And then alfalfa is really good too. And the key thing about alfalfa is that long stem alfalfa will be more effective than pelleted forms or cubed forms. And the reason for that is the fiber content. It's going to have high fiber, which is going to make your horse chew more, which is going to make them produce more saliva. It also has calcium. So calcium is a good right? It's a Tums for horses a little bit. So it works really well for that. And then think about the timing of your feeding. So horses go through a natural reduced feed intake kind of in the middle of the night. They eat up until about 10 p.m. or so, and then they don't eat as much until kind of maybe 4 a.m. or so. So if you can have alfalfa be their breakfast meal, that's a good way to break that fast. It gets some saliva in there, gets some roughage in there. If you can get your hands on alfalfa, that is. So it's a really good snack, part of breakfast, and also as a snack prior to work. So right before you're asking them to kind of work out a lot, you want to kind of buffer that stomach, give it something so that that quote unquote splash effect isn't quite as significant when they're in work. Then avoiding and decreasing use of anti-inflammatory drugs. So NSAID medications will increase risk of ulcers, for horses developing ulcers. And that stands true for Banamine, Bute, also Equiox. Equiox is a more selective NSAID. So a lot of times we use it for long-term in horses, especially elderly horses. I count those ones that I have that are, they get their 1 Equiox every single day once they reach a certain age. But all of those medications will increase the risk of ulcers. So if you have a horse that's maybe on layup, or it's, maybe has a hoof abscess, and it's gonna be on bute for a few days, for a week for that, and it's gonna be on some stall rest, it's got a change in activity, a new medication, and it's a bit of a stress case, that might be a worthwhile horse to put on a preventative dose of omeprazole, or some medications or something. So something worth discussing with your veterinarian, especially around those stressful times for them. And then limiting stressful situations and intense training. And again, I think it's an important distinction. It's not to say that horses in work, any type of work, are going to be an increase of ulcers. I think it's the intensity of work that's really important to consider, because actually a routine and having, where they do get seen regularly and they do get some exercise regularly, that's actually quite beneficial. So it's having a good, nice routine for them when they get work, that's great. If they're being asked for more and more and more every single day, that's where that intensity might be a little bit problematic. Sometimes that's what we need, right? Sometimes that is our goal. If they're a high-level sport horse, that is what we do. We ask for a little bit more every single time. So then I've had a lot of those horses where they kind of live on some level of antacid medications during the heavy, stressful season. And then maybe they can be off of it during the non-stressful season. Supplements, another one that I think comes up very frequently, because there's tons of supplements out there. People love supplements. I love supplements, right? My favorite thing to do after work is to make my horses a bash. I get very offended if they don't like it, because I've slaved away making it. But it's a poorly regulated field. So there's lots of options out there. Some are better than others. Some have research behind them that's valid. Some have somewhat bogus research behind it. You kind of have to do your homework on it. I have owners all the time come to me with supplements and things that I've never heard of. And I'm always like, oh my God, tell me about it. Is this the new, is this the, the silver bullet we've been looking for? Will it cure all my problems? Generally, not all of them are amazingly spectacular, but I will say that some work well for some horses. A little bit of trial and error. But do read their contents. Like, read what they're made out of, these supplements. Don't just read like the big shiny, front page, your horse will be the best ever and will never die. That's probably not a realistic goal. Read what they actually contain. So I think that becomes useful, especially if you're looking at a cupboard full of 500 different supplements, and you've got one for hooves, and you've got one for their respiratory system, and you've got one for their anti-inflammatory, one for their joints, and one for their gut, right? The list goes on and on. So look at what you're actually putting in. Some of them are going to have overlap, and some of them you might be able to, to say, like, I probably don't need this at this stage. And these are, again, this is not to say that these are the supplements to try. These are some supplements that I have found that owners have reported back to me that their horses did well on, so I kind of like to include it. But it has a little bit of a note of like exactly what they are. So platinum gastric support it's a pre and postbiotic. It's FURst Aid, soya fermentation product that has some research that has shown that it helps reduce GI inflammation. Purina outlets is mainly just the buffering agent. Well, it's a little bit like Tums. Truly, it's like Tums. So it's not, most of these also are not going to treat active ulcers. If you have horses had ulcers and you've treated them, they're gone, this may help keep them at bay. But if your horse has active ulcers, most of these will not treat them. And the other thing to keep in mind too, if you're using Purina Outlast, your horse is also on omeprazole, maybe don't give them at the same time, because this is a buffering agent that will reduce the acid that you need in the stomach in order for the gastric artery to work. So this is another important plug for like, tell your vet what you're doing and when you're doing it. And if your vet seems like they're in a hurry, be like, hey, give me a time and a place, maybe it's over phone, but I need to tell you these things and you need to know these things. Because I think it can be very helpful to get again, the most effective treatment and the most effective management for your horse. Smart Pack has one as well. It has a buffer anti-inflammatory. I think there's aloe vera in there as well, which again has some research that maybe kind of helps, but it's not going to treat your ulcers. It's not the one-all thing that does everything. Godex, it's an HA hyaluronic acid supplement. It's HA hyaluronic acid, that's some of the stuff that we put into horse joints in order to reduce inflammation in those. There's reasoning behind it. But it's not amazing. And CBUC, which that website looks the worst. I think that when I looked at that website and I was like, this is not real. This is all fake. It's like really bright colors. And whenever I see bright colors in advertising, I'm like, that's gonna be fake. But they actually do have some research that says that it is, and it's these sea buckthorn berries. So it doesn't actually have anything to do with the ocean. But there has been some research that those do help reduce the risk of specifically glandular ulcers. So not squamous ulcers, but specifically glandular ulcers. All right, that took a while. You guys hung on, nobody left. It's amazing, nobody was like, see you. Happy to take questions. You can start wherever.
What is a concern for like opportunistic infection of the microbiota with ulcers?
Yeah, great question. So the question is the risk of infectious microbiota or like disbalance of microbiota or infections with gastric ulcers. And I think that's a good point. And thank you for bringing it up because I didn't mention it in my slides, but in people, gastric ulcers are associated with the Helicobacter bacteria. So a lot of times people with severe gastric ulcers go on antibiotic treatment. We have looked into that in horses and we have not found that to be the case. So there's and we haven't found a bacteria that's a causative agent for it at this time. So at this time, we generally do not recommend antibiotic treatment for horses with ulcers. And I say at this time because I don't know what the future holds, and I don't know if some other future research will disprove us potentially, but at this point, we have no evidence for it. On the other flip side of it, kind of the pre and probiotic and normal flora of the intestines, there's a lot of research going on that topic now. A lot of it is a little bit difficult where you get your samples from. So there's currently a lot of research on the hind end microbiota coming out, right? So the culturing and sequencing of manure and seeing what type of bacteria are present, how those populations change based on the disease status of the horse, either with ulcers or colitis or like arthritis or something. How does that type of stress impact their microbiota? And can we, solve that backwards? And can we feed them a different type of bacteria to make them better? There have been studies that have shown a difference in the normal microbiota and flora of horses with ulcers and without, but we don't have much more to say, feed this particular thing and it'll make it go away. But that's why a lot of those other supplements contain pre and probiotics, like the gastric support from platinum. Part of it is from that research. If we can improve the microbiota, will we then reduce the risk of gastric ulcers in horses? So I think there's valid, options for treatment, options for management that way. But I do think pre and probiotics have a lot more to give us as far as answers in this field. Thank you for that question. Right. Okay. Oh, perfect. That's like I wasn't worried about the 17. All right, so we'll talk about how quickly ulcers can develop with stress or kind of house. And then I'll get this question a lot with owners too, because we'll scope and we'll see we'll see ulcers, and then it was like, when did this happen? When did this occur? Like this horse took a bad step a week ago. Was that the ulcer? And that's a great question. There's some studies have shown that ulcers can ultimately develop as quickly as a couple of days in the right circumstances. So they have, scoped horses and then stressed them out, or ones that are systemically ill. For example, if your horse develops colitis for whatever other reason, now they're sick, now they have impaired, in a pro-inflammatory state, so their blood flow is impaired and they're on other medications, they can develop pretty fast within a couple of days. On the scope itself, I can usually say if they're a little bit more chronic, long-standing, because you'll have a bit of a thickening of that marble plicatus, that line demarcating the squamous and the glandular portions of the stomach. It can get thicker over time, and that takes some time. That's not something that's going to happen immediately, versus an abrasion or a hole that can happen a little bit faster. The certain layer of tissue kind of died away. And the way that ulcers heal, it's actually very similar to your skin. So this is where kind of the length of treatment can come into play as well. If you think about having a one large deep wound and how long that will take to kind of fill in and heal all the way versus a lot of little pinpricks. It might be the same surface area, but because that heals from the outside edges in, it's dependent on kind of the circumference to ratio to the internal kind of size of it, to the volume. This is kind of, I guess I'm going off on a bit of a tangent, but comes back to a little bit on how quickly lesions can also develop. A couple of horses that I've seen have also had ulcers secondary to like a foreign body. Like I think at one horse that the video, I think that horse like ate a stick or something, because that looked like it was just hard with something. So those we can certainly see in horses with choke that takes a little bit longer to resolve, and then we scope their esophagus afterwards. We'll see ulceration in the next couple of days after like an acute choke episode where there was compression of that mucosa. So it can be pretty quick. We can sometimes tell when something is chronic on scoping. Ultimately, it's really hard to give a very specific timeline. I can sometimes also see areas where there was a previous big ulcer that has since healed, and you'll kind of see a bit of an island form in those areas. So you can usually say like, hey, this horse has had pretty significant ulceration at some point. That was long enough ago that that has actually healed by now. Is the Carlson ever administered on its own or also in combination with the medication? It can be administered on its own. So it's oftentimes that we are, for treating, it's not an antacid on its own. I guess that's the key thing. So for treating gastric ulcers, a lot of times with other medications on board as an acid suppressing medication. But I have used sucralfate on its own for horses. Some horses I've had, they respond relatively well to it to keep their ulcers at bay, and it ends up being a little bit cheaper than doing the quarter tube of Gastrogard a day. I would recommend talking to your veterinarian about it, but they're certainly something we can just prescribe on its own. And usually that's my mainstay for any oral ulcerations. If I'm doing like a dental, and I notice there's a lot of oral ulceration for those chokes that get abrasions in their esophagus, those guys usually go on just sucralfate. Efficacy of albuterol, not aware of that specific product. Don't know there aren't studies. So that's kind of the trouble with some of these other types of drugs. I will say there is an Australian product out there. I don't know if that's maybe the question about that. There is an Australian product that's an omeprazole product that does work pretty well. I can't sell it because it is not FDA approved. So there's Gastrogol ultimately is still the only FDA approved medication. That's the only one that I can sell. If you as an owner get your hands on medications on some other ways that the FDA does not know about, don't tell me. But there is an Australian product that is efficacious, it works. Risk of omeprazole low dose long term for prevention of ulcers. That's a great question, because in people they have found that chronic use of they're starting to find that there may be some issues with chronic use of omeprazole in people. Usually people studies are talking about like 52 months of use or something like that. I'm like, man, gotta have some deep pockets for that in a horse. But I think that is a valid consideration. In some human studies, they have also found an increased risk of glandular polyps in those people who have been on long-term omeprazole use. And I kind of wonder about some of those warm blood horses that have a higher incidence of glandular ulcers, that in my at least clinical experience, I don't have the research on it, but clinical experience, I feel like those horses tend to have their quarter tube of Gastrogard during the show season pretty regularly, and they may live on Gastrogard, somewhat regularly during the show season. So are we inducing that type of ulcer in that population with this treatment? I don't know the answer to that, unfortunately, but I do worry about it. That's my non-answer to that.
Can I ask a follow-up question?
Yes.
What about esomeprazole? Would that be the same thing?
Potentially the same thing, but we don't know because we just don't, we don't have any studies in the horses. So yeah, I would have to honestly look at the human literature and see if they're seeing the same type of issues in humans on the esomeprazole, but I feel like they probably developed it in order to reduce some of that. So maybe that's an answer. We need more funding to do some of these studies. How do anti-inflammatory medications contribute to ulcers? Great question. So they impair kind of the natural, so there's kind of, to make it maybe slightly simple, but still complex enough to answer the question. The end says non-steroidal anti-inflammatory medications work by blocking certain pathways and cytokines, kind of signaling pathways in the body, and part of those pathways kind of share dual purposes. So some of them might increase, like inflammation, for example. With inflammation, if you have an infection someplace, you're usually feeling redness and heat and swelling of the area. That's generally from increased blood flow to that area, which if you have an inflamed and painful something is bad and you want to reduce it. But increasing blood flow also stimulates healing and helps things heal a little bit faster. So if you're doing a blanket, everybody has less blood flow. The stomach, which relies on that mechanism to reduce kind of trauma to it, isn't getting that support. And so although your leg doesn't hurt anymore because you've reduced inflammation in that leg, your stomach now says, I'm like an innocent bystander. Why did you have to treat me too? So that's kind of the simple-ish answer to that. They, in their process of blocking inflammation, they block some protective mechanisms that the stomach has in order to prevent ulcers from happening there. Great. I was positive this would come up, so the kind of expected cost of scoping. Did look at it, and I will say it does depend a little bit on each practice. It's going to be a little bit different. We don't do price, setting in the veterinary field. We don't call each other and you're like, hey, how much are you charging? Are you charging that much? I'll charge less or more. We don't do that. For our institution, on average, it depends a little bit if we've seen your horse here before, if we have, discussed this case or this procedure before, as far as if there's additional physical exam fees, etc. Sedation costs vary. Sedation costs will vary on the horse a little bit. Some require more sedation than others. Some are heavy drinkers. Some just need a whiff of whiskey and they're out. So on average, if we haven't seen your horse before and we're doing a physical exam, a scope with some sedation, you're looking at around $700 or so, which again, it's not cheap, and I fully realize that. It is cheaper than a month-long treatment of omeprazole. And I have, in some cases, based on, we scope the horse, we look at it, and I'm like, hey, these ulcers, they're extensive, but they're kind of those small pinpoint ones. I think our treatment recommendations can be half a tube of omeprazole once a day instead of a full tube. And in those cases, I basically kind of pay for my scope with the savings and medication if we otherwise just did a blanket. Well, the general recommendation is 1 tube once a day for 28 days. So in some cases you can save, quote unquote, save money that way. Ultimately, more information is always better. I do generally recommend doing a recheck scope before we finish treatment, just so that we know that yes, we treated what we needed to treat. There's nothing else that's come up. Because if you stop treatment before those ulcers have fully healed, they'll just come right back. Right? It's like if you have a wound and you've been really diligent, you've been cleaning it, and you haven't been picking at it, and when it's 90% of the way there, you're like, you pick it open, and you're like, oh, that's enough. Won't pick it for it today, but like the next day, you're like, just a little bit, right? So it's not gonna heal all the way, and it's gonna keep festering. Does age of horse contribute to chance of having ulcers? Great question. We haven't found a specific age-related correlation with it. I think, and it's hard because it's difficult to kind of separate their use and the activity, the amount of activity they're under, and an age. And the one thing that I will say, I think, usually younger horses that aren't quite broken, like truly babies, they're on mom, and nobody's bothering them. They have low incidence of ulcers unless we start messing with them, in which case they have high incidence of ulcers. So most foals that get sick, that come into the hospital and they're on medications, a lot of those guys are really susceptible to developing ulcers, especially with almost any length of NSAID use, those non-steroidal anti-inflammatories. I'm usually very cautious about putting young foals on that for too long, because they will develop ulcers very quickly with it. Otherwise, most older horses are not in a high stress, high grade environment. And because I think this disease has such a high correlation between the horse's use and environment and their husbandry, I think that has a bigger impact rather than their age. So if you have a horse that's maybe it's on a high grade diet because it doesn't have many teeth anymore and it keeps losing weight, and you keep changing barns because you have to keep moving or something like that, maybe that horse has enough stressful stuff that it has higher chance of ulcers, versus a pasture pet at 10 years old who's going to have a lower risk just from the environment that it's living in. And then the last one, is there any relationship between ulcers and fecal water syndrome? So great question. So that's kind of goes back to that diarrhea question where we used to say that that was a common or a possible clinical sign of ulcers in horses that has generally been disproven. So there's not a clear link with that. I will say, and this also comes back to that right dorsal colitis question, though. Right dorsal colitis horses with some inflammation in their colon, those horses I do generally see some loose manure in. Maybe a lot of times it's like full on diarrhea. It's not just a little bit of that squirt at the end when they like a normal pile and squirt on top of it. The right dorsal colitis horses usually have diarrhea. And some of those horses that may also have ulcers. So I wouldn't say based on a physical exam alone, if you said my horse has fecal water syndrome, I'm really worried about ulcers, I'd say we can scope for ulcers and we can check, but based on that information alone, I wouldn't very strongly suspect gastric ulcers as an issue. I would generally recommend increasing the fiber diet of that horse. Because I think it's more of a lack of fiber, which would be helpful if there were ulcers. So it's hopefully that's somewhat helpful. Are ulcers more likely to return once a horse has had them? Yes, that is something I generally worry about. So once I have diagnosed ulcers in the horse, I do then have that discussion of prevention, and the next time you trailer someplace, probably do the preventative dosing, with some medication. I know that and it depends a little bit, I think, in some of my X-race horses. So my off-the-track thoroughbred that you just picked up and it's 4 years old and it's retired sound, hopefully, and it's going to become your next dressage prospect, a 3-day eventer or barrel racer or whatever. Those horses have such a high frequency of gastric ulcers. Part of me is always like, just treat them for ulcers, and then if they're not doing well, like we'll scope them then. But those are ones that I would maybe think about scoping, treating, and a lot of times those ones, as long as we get them on a good management plan, I don't worry about the recurrence quite as much. Because I think they're just, the racing environment is just so stressful and so different from anything else they're going to have later on in their life, that as long as we address that, I don't have a high suspicion they'll come back unless we put them back on a racetrack. So I think there's more of a distinction, I would say, between squamous ulcers and glandular ulcers. Squamous ulcers, I worry about them coming back, but I think they respond to treatment a little bit better. They're a little easier to treat. And some of them, I think we can treat it, forget about it. Glandular ulcers, I think those are the ones I do worry about. They're in the back of my mind, or when I fall asleep at night, like, how's that horse doing? Does it have ulcers now? Again, or back or something. So I do worry in those cases. So it's something worth mentioning. If your horse then sees somebody else and they put it on a longer course of non-steroidal anti-inflammatory medications or something else, be like, hey, this or has a colic episode, and say this horse has been diagnosed with ulcers before, this is where they were, this is how severe they were, because your vet then may change their treatment plan in that case. Ulcer prevention supplement recommendation for horse that has been treated for both squamous and glandular ulcers. And this is again, I think this is one of those cases where I would recommend a good conversation, with your vet and kind of take him through everything that horse is eating, what times that horse is eating, because I think some of that supplement recommendations will depend on what their current diet is. So the question is your horse on any alfalfa? Is it on any pasture? How frequently is it being fed? Because based on those results, I might recommend a certain type of supplement more than the other. You can always, I think probiotics, like our previous question brought up before, it's always fair. It's going to be generally helpful everywhere. The only thing that probiotics I sometimes worry about is in young foals that don't have their own normal microbiota yet, you can overgrow the probiotic stuff. So if you give them too much of the yeast stuff, they will grow too much yeast stuff. So I tend to be a bit more cautious with probiotics in young foals. Adult horses, I'm less worried about the negative side effects of that supplementation. I think generally it's honestly quite safe. Some products are better than others. Some products have more research behind them than others. There's a lot of research coming out, so read the back of the labels. I strongly encourage everybody to read the back of every feed label that they get. Kind of be proactive about what you're feeding to them and look at it critically. If you're feeding the supplement and you're like, I don't see a difference, don't keep spending your money on it. if you're feeded and your horse is doing well, and you're gonna ask me like, should I keep my horse on it? It's doing really well. I'm gonna say, yeah, I mean, I feel like you should keep on it, because I feel like I'm gonna tell you, no, you can stop, and then next week you're calling me because the horse is colicking, and maybe it was gonna colic anyway, but in the back of my mind, I'm gonna say, oh, pulled it off that one supplement, now it's colicking. So it's, be critical of what you're doing, be objective. Ultimately, we don't always have a perfect answer. Very good question. What is a warm-blooded horse? I just had this in my lecture for the first year class, so it's part of my welcome to equine veterinary medicine. So when we talk about, so you're gonna get the first year lecture spiel about this. So we talk about blood horses in horses. It comes from a 17th century term, English term, meaning of good breeding. So good blood meaning good breeding. And a lot of times we kind of distinguish horses into hot bloods, cold bloods, and then warm bloods, and it has nothing to do with the actual temperature of their blood. Should be about the same across the board. It has more to do with their kind of reactivity and their energetics, athleticism, etc. Hot-blooded horses, you generally think about thoroughbreds, Arabians, which Arabians are the, base breed for thoroughbreds. Those are your racing horses. They're highly expressive. They're highly active. And so they're bred for these hot things, right? If you want to ride something into battle very fast, you want a hot-blooded horse. Cold-blooded horses, on the other hand, were bred for more kind of agricultural purposes. Think of your big lumbering draft. They're here. They're gonna get there eventually. They're not worried. They're calm. You can strap whatever equipment you need to them, and they'll literally just plow the field with it. So they're kind of cool, collected, calm. And so a warm blood is naturally a combination of the two. A little bit of drafty. So theoretically, they're supposed to be a little bit calmer than a hot blood, but a little bit more athletic. And that combination can sometimes happen in different ways, where they're just big and also freaked out. So that's my note on that. All right. Yeah, sorry, there's one last question. Giving alfalfa before trailer ride or trail be okay to keep also? Yeah, I think I would. I think I would, depending if your horse, I guess this would be one where I'd say, sorry, I should read the question so that everybody hears it, but would giving alfalfa before trailer ride for a trail ride be okay to keep ulcers at bay, or does preventative meds have to be administered? It sounds like this is a horse that was scoped and treated for ulcers, but had been on Equinox for 3 weeks and never had ulcers before. And it's an older horse. I would say it depends a little bit on the severity of those ulcers. So is these really deep ulcers, or just a little bit of a speckling of mild abrasions in the stomach? I'd say if you had a horse that scoped and had really deep ulcers and it took a long time to treat, I probably maybe would recommend more of an antacid medication in that case as a preventative, versus if it was more superficial ulcers and they healed a little bit faster, then I think giving some alfalfa snack, again, that long stem alfalfa, we'll put a plug for that, more effective than, not to say that pelleted or cubed wouldn't be effective. Long stem alfalfa is certainly more effective for keeping ulcers. It just acts as a better buffer at keeping ulcers at bay. Perfect. Well, thanks everybody so much. This was fun.